Hello everybody and welcome to the latest webinar from the National Youth Agency on our COVID-19 guidance. We're recording this on the 1st of April as there's been some changes to the regulations, or they've been removed. So we're going to give you all an update on what we need you to follow and what's changed. Key things as always with our webinars. The National Youth Agency is the national body for youth work across England only. So if you work in other nations, you should pay close attention to what Scotland, Wales, Northern Ireland are requesting or requiring you to do. There may well be subtle differences even now. So yes, if you're in England, follow the NYA's guidance. If you're in other nations, do take a look at those countries' requirements. If you're part of a national association, and we've only got an absolute selection of them on screen, you should also lean on your national body to advise you and guide you. They may have additional measures or slightly different measures that they require you to undertake as part of their normal operations. Less and less so these days, but still worth paying very close attention if you're part of a national association. So we did this a little while ago. On the 27th of January, we moved to green, and that was the good news, which means all the youth sector activities can take place and keep going. But we've got to be very conscious of COVID-19 and aware of the risks still. It has not gone away, and we're very keen to make sure the colleagues are very aware that we still have significant risks around this. But in terms of the readiness framework for England, as of the 1st of April, we remain at green, and that's good news. It means we can carry on and do pretty much everything we want to do for young people. We're today publishing version 11 of our guidance. This is maybe the last version we get to put out, hopefully so. But from the 1st of April, version 11 is the version that you need to be paying attention to. And as always, our guidance is developed in consultation and in consideration of advice from the UK Health Security Agency, who were Public Health England, and the Health and Safety Executive, working alongside colleagues at DCMS, etc. You can find a copy of our guidance on our website, and you can always check what the readiness level is on our website as well, should it ever change in the future. I should say there are some changes to our website coming. At the moment, we have a big bar across the top of the front page that says what the readiness level is. That is going as of today, but you can scroll down the page, you'll find the guidance link, and from there you'll be able to spot the readiness level. Trying to get back to normal, trying to learn to live with COVID, I think is the phrase everyone's using, which is absolutely right and proper, but the risk of COVID-19 has yet to vanish from our shores, and we've got to be careful. So version 11 from the 1st of April, everybody should read it and follow it. And there are some changes which I'm going to talk you through as we go through. One of the things I wanted to highlight, though, was this was an article in the Times yesterday from Dr. Dame Jenny Harries, who's the head of the UK Health Security Agency, who's telling us all to recognise that actually COVID levels are now the highest they've ever been in society and communities. Now, vaccines are making things less deadly and making it easier to live with, and so people are mixing, and therefore legal restrictions have been removed. But COVID-19 is, 1 in 16 people, as I record this today, have got COVID. It's estimated in England, and that's huge. That is the highest it's ever been. So actually, we've got to be really careful, because actually the youth sector works with some of the most vulnerable young people, but they then go home and mix with their families, mix with their parents, grandparents, etc. So we've got a duty of care to be considerate, but we want to be, moderate, and we want to be careful, and we want to keep going with what we can do, and we want to allow the youth sector to have, a great 2022. So what this article just says is, start wearing masks again because of high levels of COVID, particularly in stuffy environments, in indoor spaces, and we encourage the sector to take this really seriously and look at what you can do. So from the 1st of April, these 5 things are all possible. We can do all our online delivery, all the detached outreach and go out and about in the community, one-to-one support for young people, indoors, outdoors actually. Trips and visits are permitted locally. You can go anywhere you like, actually, in terms of trips and visits. They don't have to be local. A day trip tends to be reasonably local, which is why we've got locally. And then you could do residential experiences, and this also includes international travel. So actually, there's no restrictions now on what the youth sector can do. We're almost back to pre-pandemic in terms of the types of activities you can do, what you can do, where you can go, what you can do. But be cautious, just be careful, and try and minimise the risk of COVID-19, because as I say, this has not yet gone away. We introduced our COVID responsible measures last time round, and these are really, really crucial, and none of this has changed at all. Um, whilst the law and the regulations may have changed around testing and things like that, actually our duty of care and our responsibility as a sector has not shifted. So we need you to keep your action plans in place. We need you to be, who's got what roles and responsibilities, who's keeping up to speed with making sure the cleaning is done and measures are in place, and we're keeping an eye on the health and well-being of the young people who come to us and their families if necessary and appropriate, to make sure that we are taking measures to minimize the risk of COVID-19. We got all our risk assessments, and we're reviewing them regularly. It's no good to write a risk assessment and leave it on the shelf and not to look at it for 6 months. Every week, every 2 weeks, you should be digging this thing out, having a look at it, going through it, adding to it. Taking things out is fine if things have changed, but we should be absolutely making sure all our risk assessments are fully up to date. Hygiene is still the #1 way of protecting the population from COVID-19. So that is your hand sanitizer, but good hand washing with warm soapy water is just as good, or if not better in some respects. So keeping hand hygiene really high is an area we're going to have to do probably for the next 18 months. You're going to be following COVID responsible measures for at least the next 18 months, we reckon. Whilst there won't be necessarily legal restrictions or requirements, this is going to be the best practice until this pandemic is declared over by the World Health Organization. Venue cleanliness and cleaning is really, really key. And it's those key touch points, those spaces and places in which lots of people's hands may touch. So keyboards, door handles, work surfaces, equipment, utensils, all those sorts of spaces need to be cleaned and washed between users. I know this is really laborious, but we've got to keep up with it, because this is the #1 way of, the ways in which we're going to protect our young people in our communities. Now, face coverings, they are not legally required, but they are recommended. They are highly recommended, particularly in indoor, stuffy, poor ventilated environments, on transportation, particularly if you're going on buses with mixing with lots of people. Face coverings provide a real level of protection from COVID-19 and are highly recommended. And then that's the language we put into version 11 of our guidance. These things are now highly recommended. They're not legally required, but they are highly recommended, and we would urge everybody to continue to use them where possible. And social distancing, again, not a legal requirement, not in the regulations any longer, but actually if you can spread out and not be on top of each other, but again, particularly in poorly ventilated spaces or tight spaces, then try and keep as far away from each other as possible without that being weird, and it's still enabling activities to take place and have good fun. And it's fine for young people to be, I don't know, building some sort of I don't know, campfire or whatever out in the fields, and doing kind of fun activities and putting tents together or whatever we do, and being in close proximity, and that's absolutely fine. And young people can be less than 1 meter apart, as we used to have to do. That's not a problem now. But if you can spread out, do. And I think that's the key message. So we're going through it. I'm going to go through everything just in detail, just so everyone's really clear, because I know some people don't read the guidance document, but they will watch this video. So this video should capture most things for you, but do read the document, because the nuance in the wording is important. So for young people of all ages, we can operate indoors and outdoors, open access, drop-in provision, all types of activities, absolutely fine. There are no limitations on group sizes. Any group of any size could come together. I mean, you would be, as part of best practice, looking at the ratios of your staff volunteers to young people, the spaces, that you use are going to have a certain maximum number of human beings that should be in a hall or a room. And you should be looking at putting those things and making sure that we're following that. But that's just good practice in normal times. That doesn't necessarily mean that we need to worry about that anymore. Face coverings recommended, highly recommended when indoors, and particularly in those stuffy, poorly ventilated spaces. Follow those COVID responsible measures I've just talked you through, and that would be fantastic. So, I mean, it's great news. We can get out and we can do stuff. Day trips and visits are permitted, and you can travel by any form of transport, to be fair now, but minibus, taxis, public transport, cars, walking. Again, but if you're in a bus or a tube or a train, and it's going to be quite stuffy with lots of people crammed in, then face coverings and sanitizer are your best friends. I'm not going to keep apologizing for this, but follow those COVID responsible measures: face coverings, hand hygiene, distance where possible. If you go to third-party venues, they may still have measures in place, less and less these days, but they may well still have them, and so you'll need to follow those measures if they exist. Face coverings are still recommended on transportation. Now, one of the changes that we've put into version 11 of our guidance, last time round, international travel was allowed, but not recommended. Now, from the 1st of April, we're removing all of that. All international educational residential experiences are permitted. You should follow the Foreign Commonwealth Office guidance, and you should also follow any guidance for any country that you wish to go and visit overseas, because actually a lot of countries still have restrictions or measures and requirements that you will have to follow. So, but from our point of view, go travel, go around the world, go and give young people amazing opportunities and experiences. We want that to happen for those young people, but follow those COVID responsible measures, and you'll be doing well. And on those things, for international travel, there is no limits on group sizes. And for residentials and activities and trips, you can bring groups together now, from different areas, different places and spaces. So if you're, a project, then you've got a group in Manchester, Birmingham, and London, and you want to get them all together in Leeds for an event, you can do so. You can invite all the 3 groups to come to Leeds, mix up, get them into different groups and bubbles or whatever. They can mix, do their activities, have loads of fun, do great stuff. They can share accommodation, all those sorts of things within your normal standard protocols and risk assessments and safeguarding measures. You can do all of those things, and that's absolutely fine. Groups can also travel together, so you can actually all meet up in one location, get on the train, and then go up to Leeds, and that wouldn't be a problem either. You can all mix up as you travel. Again, COVID responsible. Now, lateral flow testing, I'm going to come back onto testing in a second. The government has withdrawn the access to free lateral flow tests. And we used to require you to test quite regularly when doing trips or residentials in particular. That has gone. However, we highly recommend using lateral flow tests before you depart. I think the best way to protect yourselves is to make sure that we've tested everybody. So we only take people who we know are COVID negative, so that way we're protecting the rest of the group from going away, mixing up, and suddenly spreading COVID. But there are no longer regulations requiring testing. But in the NYA guidance, it is highly recommended to test before you depart. This includes your staff and leaders. And if you go to any venue, a residential venue, they may still have, mixing of group sizes, spacing and distancing. We're still seeing venues require some of these places. It's a real mix around the country. So talk to the venue, talk to your partners where you're going to visit, and they will advise you and guide you on what you need to do. Now, again, COVID is still a real risk, isn't it? So if a young person shows sign of illness, then they should be tested. So try and take a few test kits with you. You will be able to buy these test kits, so hopefully they won't be that expensive, but I recognise it's a cost. But if a young person suddenly shows sign of illness, all the signs and symptoms of COVID, cough, sore throats, they look a bit like a cold and flu these days. It's worth taking a testing kit with you or two, test those young people, and transport them home, private transport if they are positive. Now, if a member of staff shows signs of illness, then maybe the whole group will need to return home. But this all depends on the ratios of staff that you've got. So if you have just enough staff to take your trip, but if you were to lose a member of staff to being ill, then you wouldn't have enough ratios of staff to young people, then the whole group may need to return home. So it may well be worth taking an extra member of staff now, just or a volunteer, so you've got additional trusted adults with you. So in the event of a problem, then that individual member of staff goes home, and the rest, the group can continue and carry on. But any individual showing signs of illness must seek a test and self-isolate. And PCR testing is still available on the NHS. You can still access that testing. It's just the free lateral flow tests that have been withdrawn. Yeah, same thing. If any member of the group shows sign of illness, seek testing. So lateral flow testing. So as of today, the 1st of April, it's no longer possible to access free lateral flow tests from the government or from the NHS. However, what the government is doing is it's pushing the flow of lateral flow tests through pharmacies. So you can go into any local pharmacy and you will be able to acquire lateral flow tests, but you will have to pay for it. I think the average cost is about £2 a test. I think the more the more these tests are in supermarkets and other environments, the price is likely to come down. And again, what we're seeing, if you go and buy a box of 10, they'll be cheaper than £2 each. So it is still possible to access lateral flow testing, and it is very sensible to test your group before you depart. But so as of now, as of 1st of April, version 11 of our guidance, it is highly recommended to test your whole group before departure. It is recommended, though. You don't have to do this. We're not requiring you to do this. The law doesn't insist you do this. But as a responsible youth sector partner and delivery organisation, we would expect you to be testing your whole group before departure. Now, we used to say to test every 48 hours, 72 hours whilst away. We've removed that. So it is literally just test before you go. Therefore, you know, as an organisation being responsible, when you left, only none of your group had COVID that you knew of, and you tested everybody. Anyone who does come positive for a lateral flow test should seek a PCR test and return home. That hasn't changed and is still a measure in the real world. There's an interesting challenge. Anybody who's had COVID in the last 90 days could still show up a positive test because they still have what's phrased as the dead virus. So the virus is in your system. Your immune system defeats it and bumps it off, but the test actually searches for a specific protein within the COVID-19 infection. And although that protein is now dead as a virus, it can still be in your system for up to 90 days. So if somebody's had COVID for 90 days, then there's no requirement to test them at all. A quick word of warning on insurance. Again, we know a lot of youth sector partners are struggling to get insurance for general operational activities. Insurance has become a massive problem for us as a sector, and it's something we are looking at the NYA. But before you go on your activities, check with your insurance provider. Make sure that you've got the right cover. Make sure that they're definitely going to cover your insurance, and if they're going to cover you if somebody comes ill with COVID while they're away, particularly on international travel. So international travel insurance policies that I've been looking at for my future holiday plans alone have become really complicated as certain exclusions apply, and you must make sure that you've got the right protections and cover. So please check your insurance cover is adequate. So with our COVID responsible measures, the use of face coverings really should continue in poorly ventilated spaces. Those are indoors, on transport, if you're doing close activities. Not including sport or singing. It's quite hard to do either of those if you're wearing a mask. They could be removed. Hygiene measures continue to be required and are really sensible, just really sensible. Keep those surfaces clean, keep hand washing, etc. Really good. You can still offer back-to-back sessions, so you can have group one in, then clean the building and the venue or wherever you're doing your work, your classroom, etc. And then another group can come in and off you go and do that as well. And you can use the same staff, the same team to do multiple sessions a day, of an evening, of a weekend, whatever you're doing. But try and clean down your spaces and the venue and surfaces between groups. This stuff is really key to minimising the risk of COVID-19. And it's absolutely fine to use public venues. We still get asked occasionally, is it okay to open my community hall to a youth project? The answer is yes. But now do I do that for months? But so just to be really clear, any public venue can be used for the delivery of youth services or youth activities. And the home visits to young people's homes are permitted. So you can go to if you do a one-to-one session with a young person and you meet them in their own home with the safeguarding measures that you need in place, then you can go and do visits to young people's homes as appropriate. Just as a final recap, really, you'll find all the latest information and guidance from the National Youth Agency on our COVID-19 guidance webpage as part of our website. You'll now just need to scroll down a little bit and you'll find the details in one of the boxes. Go in there and you'll be able to find a copy of this video. You'll be able to find how to download version 11 of our guidance, and there are other tools and resources. There's links to the Youth Work Support website, which has got hundreds of resources for youth workers and young people and parents, and access to our safeguarding hub can also be found via our website, which will help you if you're trying to understand your safeguarding requirements and risks. So that's it. That's it from us, really. Follow these COVID responsible measures. Let's make sure we are being super careful. In a world in which COVID-19 has got the highest rates in England that we've ever had, it can feel a bit strange that we've removed all the legal restrictions. I understand why that's been done because of vaccines and what have you, but under 12s are not vaccinated unless, some are, but only if they've got vulnerabilities or others around them that are vulnerable. But the vast majority of under 12s not vaccinated, and the youth sector is really busy with, young people aged 5 to 11. So, actually those young people have no protection at all, and yet they go home and mix with other parents and grandparents and other family members and friends. So our role as a sector is to be responsible, is to support the sector to operate effectively, follow these 6 things where appropriate. But as of today, the law and the regulations have completely gone, and that testing is no longer required, face coverings and distancing isn't required, but is highly recommended. Thanks for joining us, and if do keep an eye on the National Youth Agency's website. Look at our other areas of support. We do a lot of work around workforce, around quality assurance, and a huge amount of work around safeguarding these days. So have a look around our website, see if there's anything else that can be there to support you. And thank you for everything you've been doing, and thank you for following our guidance, and thank you for working with young people. And have a great week. Take care. Thanks a lot. Goodbye.